Hi, everyone. Uh, Welcome to a brief description of the HOME program. My name is Matt Witchery, and this is an overview of some work that we're doing here at the University of Iowa, currently being funded by the Community Pharmacy Foundation. My collaborators are Bill Doucette and Corey Knelty. I am Matt Witchery, and let's get started. What is the HOME program? It has three main components. The HOMEQ is a 20-item self-administered questionnaire of risk factors that we picked up from the literature and some discussions with experts. Pharmacists make up a home action plan with the patient so that we have documentation of agreed upon strategies for addressing the risk. Underlying all of this, we have the home communication approach, which is an open and curious inquiry into the patient's practices, needs, and beliefs. How is this different from, let's say, medication therapy management or comprehensive medication reviews? Well, historically, those workups have primarily focused on the medication list. Pharmacists can identify and resolve drug therapy problems. That's what they go to school to do. Things like the dose is too low. There's duplications, interactions. A lot of these can be identified by software, and then it's up to the pharmacist to intervene, communicate with the physician, whatever needs to be done. While those are important, a medication list focus misses the patient's voice and their experiences. These are often looked, and pharmacists aren't often using this as an important data source. The HOME program, we believe, could serve as a useful supplement to the traditional medication list workups like medication therapy management and comprehensive medication reviews. Again, the goal here is to get that patient experience, that patient voice into the conversation and have the pharmacist react to it. So here's the first 10 HOMEQ items that you can look at. And they range anything from the use of vitamins and over-the-counters, which pharmacists often aren't privy to, the use of multiple pharmacies, the perception that they need a better way to organize their medicines, not filling things due to cost, running out of medicines. We have some items here that relate to concern beliefs and necessity beliefs about medicines. And we end here on the need for more support managing medications at home. Patients respond yes or no to these, and then those are things that the pharmacist and patient discuss within the HOMEQ workup. So the pharmacist and patient, the pharmacist will fill this out, the HOMEQ action plan. They'll talk about the individual items that were responded yes to, and the pharmacist and patient will try to problem solve strategies and actions that address them. We provide the pharmacist in the training a little resource that has some recommended targeted interventions based on the individual HOMEQ items. So anything from a reminder to do a drug utilization review based on the OTC and vitamin use. Are there contradictions or contraindications there? Are there organization solutions? Are there ways the pharmacist can help with cost? Reminder systems that the patient might not have developed on their own. Those are all we have deemed medication-focused interventions. And then we also have the patient-focused ones, which surround education, motivation, identifying ways that the patient can get the support that they need at home, health literacy, and others. We put side effects under both of these. Here's the home communication approach, and it starts with setting the agenda. So we recommend that pharmacists ask the patient, what yes answer would you like to discuss first? When they are having a discussion, to be curious. The patient is the expert in their own approach. They've developed this maybe over years of medication taking. So we don't want to immediately disregard what they've done. They're an expert in their own life. We can maybe provide some recommendations or suggestions, but ultimately the patient's going to do what they're going to do at home. And so we want to be that trusted resource. You might not get to iterate them, and that's okay. Problem solving. We recommend that pharmacists in the HOMEQ process, the home program process, that they ask permission sometimes before giving advice. It could avoid sounding too critical. We don't want patients getting defensive. Roll with the feedback in the process. Maybe multiple items are getting at the same need or topic. We don't need to necessarily reinvent the wheel every time. And then wrapping up, what are our agreed upon solutions that we're going to follow up on going forward? So what are we doing in the Community Pharmacy Foundation grant? We've recruited 3 service-oriented pharmacies to help us out. Each are going to recruit and administer the home program to 25 patients each. Patients will self-administer the HOMEQ. They'll take it on their own, either at home or in the pharmacy. And then the pharmacies will bring the patient in to have the discussion. Ideally face-to-face. There might be some telephone if it fits the patient's needs. We're staggering our pharmacies so we can apply learnings from one to the next. So we've already done 25 at our first pharmacy, and now we've started with our other pharmacy, our next pharmacy. 3 months later then, after the initial HOMEQ and home program interventions, we're going to call the patient to re-administer the HOMEQ and inquire about what action items they've kept up with, because we'll have the pharmacist's notes. Alternatively, we're going to recruit 15 of those 75 to do a home visit. They'll be partially similar to the telephone call, but in addition, we're going to observe medication organization process and the environment. We're going to be looking, are there some HOMEQ items that when we get into the patient's home that we can pick up on as we ask them to walk us through their weekly or daily medication taking habits and routines. So our analyses, when we get all our data back, we're going to see, are there HOMEQ items that we want to modify, add, or delete based on all our data? We're going to qualitatively analyze the feedback from the patients and the pharmacist about the process. We're going to test for a decrease in HOMEQ yes responses. We're not sure, but that might suggest a decrease, suggests that a decrease in risk factors for misadventures. We want to see, is that HOMEQ something that moves over time after the pharmacist's intervention? Then we want to code and quantify pharmacist interventions and assess at 3 months. All right. So that was a brief overview of the home program. Thank you for listening. I'm Matt Witchery again. Email's up on the screen. Let me know what questions you have. I'd love to talk about it with you all further. But with that, I'll stop the slides. Thank you.